Most anti-aging advice never talks about your liver, but your skin does. If you have noticed a redness on your palms that comes and goes, or tiny red spider-like marks on your chest and neck, or a yellowish tint creeping into the whites of your eyes, your skin may be sending you a message that has nothing to do with aging and everything to do with what is happening deep inside your body right now. These are not wrinkles. These are not sunspots. These are warning signs, and most people your age have never been told what they look like. I'm Dr. Claire Bennett, a board-certified dermatologist, and I've spent more than 20 years helping people understand their skin. Welcome back. Here is something I want you to hold on to through this entire video. Your skin is not just a surface. It is a window. And when your liver, one of the hardest working organs in your body, begins to struggle, it almost always shows up on your skin first, before a blood test, before a symptom you would even think to mention to a doctor. In dermatology, we are often the ones who catch liver disease first, precisely because of what we see on the skin. By the time many people reach their 60s, they have been dealing with spots, redness, and nail changes for years, and every single one of those changes got blamed on aging. Sometimes that is accurate, but sometimes it is not. And knowing the difference is exactly what today's video is about. Before we go any further, I want to ask you something. How old are you? Drop your age in the comments right now. I read every single one, and it genuinely helps me make sure I'm talking to you in a way that actually fits your life. Now, grab something to write with, because we are going through 9 specific warning signs of liver damage that show up on your skin, your nails, and the whites of your eyes. Stay with me through number 3, because that one surprises almost everyone. And number 7, which is the penultimate one, is the one I want you to pay the most attention to tonight. Number 9, red palms that blanch when you press them. Take a look at the palms of your hands right now. Not the backs, the palms. Press your finger down firmly on the pinkish or reddish area near your thumb pad and the base of your fingers, and then let go. If the redness disappears under pressure and comes flooding right back the moment you release, that is called palmar erythema, and it is one of the earliest skin signs of liver stress. Here is why it happens. Your liver is responsible for metabolizing estrogen. When the liver becomes damaged or overloaded, estrogen builds up in the bloodstream, and that hormonal disruption, combined with changes in circulation throughout your arms and legs, causes the small blood vessels in your palms to dilate abnormally. The result is that warm, persistent redness, especially concentrated near the thumb side of the palm and the fingertip pads. Now, I want to be honest with you, because that is the whole point of this channel. Palmar erythema is not specific to liver disease. It can also appear in rheumatoid arthritis, hyperthyroidism, and diabetes, and it is extremely common in pregnancy. So if you are seeing this on your hands, it is not a reason to panic. It is a reason to pay attention and bring it up at your next appointment. You did not do anything wrong. Your hands are just telling you to look a little deeper. Number 8, spider angiomas appearing in clusters. A spider angioma looks exactly like what it sounds like. There is one central red vessel, slightly raised, and then tiny blood vessels radiate outward from it in every direction, like the legs of a spider. They range from a few millimeters across to about the size of a small button. They tend to show up on the neck, upper chest, face, and sometimes the backs of the arms. 1 or 2 of these in an otherwise healthy person is not necessarily alarming. Studies suggest that somewhere between 10 and 15% of people who have no liver disease at all may have a small number of these. They can also appear during pregnancy or in people taking estrogen-containing contraceptives. That same liver-estrogen connection is at work here. But here is the part the label leaves out. When spider angiomas become concerning, it is not about having one. It is about having multiple appearing all at once, without a clear hormonal explanation, like pregnancy or estrogen medication, and without the flushing, burning, or bumpiness you would expect from rosacea, which can produce similar-looking dilated vessels. In rosacea, those vessels come with a whole set of other symptoms. In liver-related angiomas, they do not. And in people with cirrhosis of the liver, the serious late-stage scarring, about 1/3 of patients will develop these. When the liver condition is treated and improves, the angiomas often regress on their own. Number 7, the paper money sign. This one does not get talked about nearly enough, and it is one of the more striking things I want you to understand. When someone has significant liver damage, those same tiny spider-like vessels do not always appear in neat, isolated clusters. Sometimes they erupt across a wider area of skin, particularly on the neck and chest, in such a way that if you stand back and look, the skin has a faint, threaded, crisscrossed appearance beneath the surface. Dermatologists call this the paper money sign, because the pattern resembles the fine security threads woven through paper currency, the kind you hold up to the light. It is essentially a widespread version of the spider angioma pattern, a sign that the vascular disruption happening inside the body has become broad enough to surface visibly across a larger section of skin. This is not something most people would name on their own, but once you know what you are looking for, the pattern is distinct. If you have noticed this kind of fine, thread-like redness spreading across your upper chest or neck, not from rubbing or irritation, not from rosacea, but just sitting there quietly, bring it to your doctor's attention. You are not imagining it. Number 6, prominent veins on the abdomen. The liver is an enormous organ, the second largest in the body, and an enormous amount of blood flows through it at any given moment. When the liver becomes scarred, which happens in a condition called cirrhosis, blood flow through the liver slows and backs up. The pressure inside the abdominal blood vessels rises significantly, and as that pressure builds, the blood finds alternate routes, and those routes become visible. What you may see are prominent, bluish, rope-like veins on the surface of the abdomen and upper chest. Not the kind that show up on your legs after years of standing, those are from different pressure systems entirely. Varicose veins on the legs are incredibly common and usually not a liver sign. But when veins start appearing prominently on the stomach, radiating outward from the area around the navel, that is a different story entirely. In medicine, this finding has a name that reflects just how striking it can be: caput medusae, a reference to the mythological Medusa, with large central vessels and smaller ones projecting outward. It is rare, and it signals significant internal pressure. If you are seeing this on yourself or on someone you love, that is not a wait-and-see situation. That is a call your doctor today situation. Number 5, jaundice and the white of your eye is the first place to check. You have probably heard the word jaundice before. Most people associate it with a yellowing of the skin. But here is what most people do not know. The skin can look slightly yellow for completely harmless reasons. If you eat a lot of carrots or squash or pumpkin regularly, you can develop a yellowish tint to your skin from a pigment called carotene. This is called carotenemia, and it looks quite similar on the surface. Here is the critical difference. When the yellowing comes from liver damage, it is caused by a buildup of a substance called bilirubin, which your liver normally processes and clears. And bilirubin turns the whites of your eyes yellow. Carotene does not. Your eyes stay clear. So the first place to check is not your skin. Look in a mirror and look at the whites of your eyes. Are they white, or is there a yellowish cast? Pull down your lower lip and look at the mucous membrane inside. Check under the tongue. In early jaundice, these moist, soft tissues often show the yellow tint before the skin does clearly. The color of jaundice ranges from a pale lemon yellow to a deeper, almost greenish tone as bilirubin levels rise. If you are seeing this in the mirror right now, please do not wait for your next routine appointment. Number 4, dark or gray pigmentation on the face and limbs. When the liver is significantly damaged, hormone metabolism goes off in multiple directions at once. And one of the less well-known consequences is a change in pigmentation that is different from age spots and different from melasma. People with serious liver disease sometimes develop what has been described as a muddy, grayish complexion on the face, as though the skin has taken on an unusual dullness and discoloration that does not respond to skincare. They may also develop darker pigmentation on the arms and legs, a brownish-black discoloration that is not from sun exposure, not from friction, not from any topical cause. This is coming from inside, from the disruption of the hormonal and metabolic systems that the liver normally regulates. It tends to be diffuse, meaning it spreads over an area rather than appearing as a single defined spot. I want to be very clear here. Most pigmentation changes on mature skin are related to sun exposure and are benign. Age spots, melasma, and post-inflammatory marks are all far more common than liver-related pigmentation. But if you have pigmentation changes that feel unexplained, that appeared without clear sun-related cause, and that come alongside other signs from this list, they deserve a conversation with your doctor. Number 3, a lesion growing on your lips or face that is soft, red, blue, and slightly raised. This one surprises people. When I describe this finding, people often tell me they assumed it was a bruise, or a blood blister, or just another strange thing their aging skin decided to do. It is called an arteriovenous hemangioma, and it is essentially a small tangle of blood vessels that has grown abnormally just beneath the skin surface. These tend to appear on the head and neck, and they are particularly common on the lips. They feel soft when you touch them, they are often a deep red or blue-red color, they do not hurt, and they are more common in middle-aged men, though anyone with liver damage can develop them. The reason they form is related to two things happening simultaneously in liver disease. There is an increase in a signal called vascular endothelial growth factor, which essentially tells the body to make more blood vessels, and there is that same estrogen disruption and circulation abnormality we have been talking about throughout this video. Both of those signals together create conditions where blood vessels start growing where they should not. If the underlying liver condition is addressed, these lesions often shrink and resolve. Now, to be honest, a soft red-blue spot on the lip can be many things, and most of them are not serious at all. But if you have this, and you also recognize other signs from today's list, bring them all together when you talk to your doctor. Context matters enormously in dermatology. Number 2, the itch that comes from inside. I want you to hear this clearly, because this is the finding that gets missed most often. The itch I am describing has nothing to do with dry skin. It does not look like eczema. It does not respond to moisturizer the way dry skin does. It is a deep, persistent, maddening itch, particularly on the arms, legs, palms, and the soles of the feet, that seems to come from somewhere beneath the skin rather than on top of it. In dermatology, we know that itch is almost never just a surface problem. Itch is a signal. And when the liver is damaged, several things build up in the bloodstream that the liver would normally process and clear: bile salts, certain progesterone metabolites, and your body's own naturally occurring opioids, all of which can trigger itch receptors from the inside out. The itch of liver disease can be constant or it can come and go, but it tends to be stubborn. Lotions help a little, then it comes back. If you have been dealing with unexplained itching, especially on the palms and soles, for weeks or months, and dry skin treatments have not solved it, please make that a specific point in your next doctor's visit. Not because it is always liver-related, it is not, but because persistent internal itch that does not respond to topical treatment is your body asking you to look at something else. Number 1, Terry's nails. This is the finding I want to close on, because in over 20 years of practice, Terry's nails are one of those things where I have watched patients miss the sign on themselves for months, sometimes years. And it is completely visible. You do not need a specialist to see it. Here is what to look for. Look at your fingernails right now. On a healthy nail, you expect to see a pink nail bed and possibly the small white half-moon shape at the base near the cuticle, called the lunula. On Terry's nails, the nail bed itself appears mostly white, not the bright white of a fungal infection or trauma, but a pale, diffuse whiteness over the majority of the nail. And then at the very tip of the nail, there is a distinct reddish-brown horizontal band, roughly 0.5 millimeter to about 2 millimeters wide. That band sits at the top edge, like a thin stripe. The other thing you notice with Terry's nails is that the lunula, that little half moon, is gone. The base of the nail looks flat and white all the way through, with no visible arc. This nail finding is associated with liver disease, and it is thought to be related to the same vascular abnormalities, the same tendency toward abnormal blood vessel formation that shows up throughout the rest of the body in liver damage. It can also appear in congestive heart failure, so like everything on this list, it is a signal to investigate, not a diagnosis in itself. But it is one of the most visible, consistent, and under-recognized signs we have, and I want you to know what it looks like. Now, before I give you the full picture, there is something important I need to say. If you recognize 3 or more of these signs on your own body today, please do not spiral. Recognizing a pattern is not the same as having a diagnosis. Many of these findings have other explanations. What this video has given you is a vocabulary, a set of specific, visible things to describe to your doctor, instead of just saying, I have this weird thing on my skin. That specificity changes the conversation. The signs that require the most urgent attention are jaundice, especially in the whites of the eyes, prominent abdominal veins, and the paper money sign appearing widely across the chest. If you are seeing any of those, do not wait for a routine appointment. For the others, red palms, spider angiomas, skin pigmentation changes, unexplained itch, Terry's nails, bring them up clearly and together at your next visit. Your skin has already done the work of gathering the evidence. Your job is just to walk it into the room. Do not try to act on all 9 of these things tonight. What you can do tonight is look. Look at your palms, look at your nails, look at the whites of your eyes. If something on this list resonated with you, write it down so you do not forget when you are sitting across from your doctor. One clear, specific observation is worth more than a month of worry. You are not being paranoid, you are not being dramatic, you are paying attention to the only body you have, and that is not vanity, that is wisdom. Which sign surprised you the most today? Let me know in the comments. And if this video gave you something useful, please tap like and subscribe so you do not miss the next one. I put a lot of care into making sure the information here is honest, accurate, and actually worth your time. Be gentle with your skin, and be gentle with yourself. I'll see you next time.